Starting the recording. It should be fine. Yeah, that's fine. So apologies for my voice, because currently I am kind of sick. Sometimes you do need to go on with the rest of your day, even if there's some problem that you're experiencing, and usually that problem isn't much of a problem itself. It's just a tiny hindrance, but it shouldn't really impact the rest of your day, and it should just let you do or continue your life as usual. The same thing goes on with insecurities as well. And one insecurity that you might have is acne. I want to start off this presentation by asking a question which I don't expect you to know, just a hypothetical, I guess. What do you think is the percentage of teenagers in the UK who are currently experiencing or have experienced acne in their life? What do you think is the percentage? Well, I've stumbled across this website from the British Association of Dermatology, and I've extracted this article from it. It's saying that acne diagnosis rates are actually rising globally, not just in Britain, globally. And for people aged 10 to 24, the acne rates are the highest right now, 2021. Well, this is just 4 years before now, but it's still pretty recent. And to give some statistics, at that year, 14.6% of adolescent young people were diagnosed with acne, which is more than, um, which is like double the percentage from 3 decades back. But what's surprising is this last paragraph saying number of adolescents with acne in the UK is actually closer to 95 when you're looking at people who self-diagnosed or self-managed their treatment. So this is saying that acne is pretty common, and it's also saying that most of acne, most acne is just very easily treatable just by yourself, just searching stuff up. Of course, with everything, it has a spectrum of severity. And this is why dermatology extensively studies acne, because it can be very severe at times, and at times, certain treatments that usually work on other people don't work for others. That's why it's very, very extensively studied. First of all, I want to look into the 3D diagram of skin tissue first of all. Hopefully these links actually work in the real presentation. But if it doesn't, then I'll just go to the next slide because I have a image of it. I don't want my skin. I don't want my sleep. So here's the skin tissue 3D diagram. Let's not get techie with it. So this is the outermost layer, and this is the skin, and then this is the hair, and the hole from which the hair emerges from the outermost layer, that's a hair follicle. It goes into this other layer, the epidermis layer, the hair, and it goes all the way down here. So the important thing to look at here, by the way, and emphasize, is this stuff, the oil gland, the glandula sebaceous, which is the one which secretes sebum. And you'll learn now that sebum is pretty important when looking at acne, because overproduction can lead to various symptoms. So, as I said, acne can be caused when tiny holes in the skin, the hair follicles, they become blocked. A way they can be blocked is where when the sebum production is too much from the sebaceous glands, which I'm just going to circle here, they secrete too much of this sebum, and it mixes with the dead skin cells, and it forms a pore on on the surface of your skin. We'll look into that in the next slide, but it's just saying here that the sebaceous glands are pretty important, and sebum is pretty important. um, you need to have a control from too much sebum and too little, because too little can also give you some skin complications, dry, flaky, and itchy skin. This is what I'm talking about earlier, which secretes too much. It mixes with dead skin cells, and both substances form a plug in the follicle. But the way the plug pore, the comedone, is created, and the severity can give two for now, two different sites. This is called non-inflammatory pimple types, and these are what they are: whiteheads and blackheads. So you can just see, just looking from this, that this one, the whitehead, it doesn't actually extrude. It doesn't go past the outermost layer of the skin, but the blackhead does. That's why the blackhead's actually black in color, because it's exposed to the environment. It's oxidized because of the oxygen around the air. So that's why it gives two different um, appearances, but there's still just non-inflammatory pimple types caused by acne. Now we're just going to look into the inflammatory pimple types. So I said before, the non-inflammatory is just a mixture of sebum, overproduction of sebum and dead skin cells. Well, for the inflammatory, it's where the normally harmless bacteria get mixed into the mixture as well. This is when I'm talking about the normally harmless, the bacteria I'm talking about is the one that's on the surface of your skin, the skin flora, which is usually there for the benefit, for benefiting your body. But it can go into those plug follicles, and these four inflammatory pimple types can form. Um, you can just see by appearance, papules and pustules are pretty much the same, except papules are they have pus inside them. Pustules don't. They both are less than 1 centimeter. Nodules are more than 1 centimeter, and they are solid and usually involve laser skin. Cysts also more than 1 centimeter, but they are softer than nodules. That's the difference, the main difference between the two. And as you can probably tell, these two are the most severe type of pimples. What do you think of the common signs of acne, first of all? What do you think? It's a pretty general question. Yeah, you'd be right with saying the face, forehead. That should be part of the face, honestly. There's also the chest, shoulders, and upper back and upper arms. So basically, the pattern of that is just those are the common locations of where oil glands, the sebaceous glands, exist the most. That's just the pattern there. So now we can look into the causes of acne because there's a lot. There's three main. Those are the three main common ones, and this is saying it is regulated. So sebum production is regulated by a complex interplay of hormones, genetics, and environmental factors. The three main common ones are these ones: hormones, genetics, and gender. Actually, hormones is thought so. Teenage acne is thought to be triggered by increased levels of a hormone called testosterone. So those are sex hormones like that. They get converted in the skin to dihydrotestosterone, which stimulates sebum production. So that's why it can be overproduced. For genetics, acne can actually run in families too. If both your parents had acne, you're more likely to get more severe acne in early age as well. That's the same with adult acne. You might be able to get adult acne if they have had adult acne. And this is interesting for women as well. The gender, women are more likely to have adult acne than men, and it's thought to be because of the many hormonal changes that they experience in certain events, such as periods and pregnancy. For periods, there's usually a flare-up of acne just before they get it, and for pregnancy, in the first 3 months of pregnancy, there is usually a flare-up of acne as well. There's also something called polycystic ovary syndrome, which gives a lot of symptoms. One of them is just acne. The others are just weight gain and formulation of small cysts inside the ovary. These are the other triggers. For my personal pathway to acne is probably the first one. So some cosmetic products, because some can still cause spots, meaning they are comedogenic. You preferably want to find non-comedogenic products. So of course, the ones which don't cause spots and aren't allergens to your skin. I just say there are a lot of apps that you can just install on your phone, which just scans the barcode of products that you can use and see if the ingredients are allergens or are common allergens or not, and just and ranks them and how good these products are for your body, and if you should actually use them in the first place. There's also certain medications, such as steroids. Steroids can lead to acne flare-ups. So don't take them, basically. There's also smoking that causes acne in older people, and the last one is diets with a high glycemic index. So when you eat a lot of sugar and a lot of carbs, you might be experiencing, or you might be more likely to have acne. So with acne, it's being extensively studied, and now they're looking at how acne can actually be um, be influenced specifically on your face. So these are the different areas of the face which have their own um, reason on why acne is there in the first place. Hairline and temples, this one, hair products, because those hair products such as shampoo and hair conditioner, those might be comedogenic, and they might not be good for your skin, your specific type of skin. It might be allergen as well. This is a T-zone for there. This is just oily skin. We'll just look at that in the future, and we'll look into the treatments later. The cheeks, rubbing or friction, so usually against pillowcases or cell phones, and for the jawline, it's usually hormonal changes. And here are the treatments for each. For the hairline, you just use simple and natural shampoos that don't contain allergens. For the T-zone, just maintain a good sleep hygiene and make sure you stress less if you experience acne in that T-zone. If you can do that by just meditation. With the cheeks, if you have those acne in the cheeks, change your pillowcase a bit, wipe your smartphone with antibacterial wipes regularly. And for the jawline, this is hormonal. Just have a lots of sugar, a lots of water, and have a low sugar diet, a low glycemic index. It's saying also research into causes of acne by area of the body is ongoing. So this is probably the most likely causes on the face. It's still going extens. It's still being studied in other areas of your body. So now we're looking into treatments of acne. So for mild to moderate acne, there's usually just one key ingredient. This is pretty good, honestly, just for treating acne. And that ingredient is called benzoyl peroxide. And what it does is it reduces the number of germs on your skin. But of course, with medicine, there's going to be side effects. And the side effects are that it can cause your skin to be dry, red, or peeling. Might not be good for you. And I think a replacement for that, a replacement for benzoyl peroxide would be azelaic acid, which we'll just look into for other treatments of other stuff. And you know, that's only for moderate, mild to moderate. If it's moderate to severe, or if that previous medication doesn't work, you might be prescribed other medicines such as these topical retinoids, so on your skin, topical that means topical on your skin retinoids such as tretinoin and adapalene. What it does is it just removes dead skin cells from the surface of your skin, so it prevents them from building up and mixing with sebum and normally healthy bacteria on your skin, stops the pimples from occurring in the first place. There's also antibiotics, and topical antibiotics and tablets. Well, it's pretty self-explanatory. It kills the bacteria. And for women with acne, and for the women who um, who most likely have acne caused by hormonal effects, then they're probably given the combined contraceptive pill in order to control their hormone levels. There's also other hormonal treatments, such as these two. Cosaprendiol for more severe acne that does not respond to antibiotics, reducing production of sebum. And this is isotretinoin. So you might remember tretinoin is one retinol. Yeah, is here. Yeah. Retinoid, I mean. Is another variant, isotretinoin. And it you can read here. There's a lot of good benefits it has. So normalizes sebum, reduces how much to produce, prevents follicles becoming clogged, decreases the number of bacteria in the skin, reduces swellness and redness in and around spots. That's pretty much that's four. But of course, with medicine, just know that the better the effects it gives, the worse its side effects are most likely going to be. Just know that. But of course, these are just hormonal and medicinal treatments. They can also be non-medicinal. This this is pretty interesting. Photodynamic therapy, using light to improve symptoms of acne, just to improve it. Hormone extraction, that's physically just how there's like the blackheads and whiteheads, physically just removing that mixture using a small pen-shaped instrument just cleans out whiteheads and blackheads. Only those, only the non-inflammatory pimple types. because with inflammatory that would be bad. It would be bad. He can make it even worse. Chemical peels. Also, chemical solution is applied to the face, causing the skin to peel off and new skin to replace it. But of course, with non-medicinal treatment, it can't be routinely reviewed or recommended, and it might not work. I just want to have tips just to combat acne, just general tips, and I'm giving you 6 right here. First one, don't scrub the face with a washcloth or exfoliating brushes. You use hands to clean the face, and you pat your skin dry instead of just rubbing roughly with a clean towel, because when you rub it, it will just cause your inflamed pimples to be more inflamed. That's all it is, because it's irritating even more. Eat a healthy diet because there is a correlation. There's no scientific proof, but there is a correlation that consuming less sugars and carbs results in decreased breakouts of acne. If you have oily hair, wash them often and keep it off your face. It's good. Shower and wash your face after working out. Don't pop up any pimples. Don't pop up pick pimples. That's pretty important. You'll look at it. Because that can improve. That can go to acne scarring as well, which is what we're going to look at, and also change the sheets. So this is what is going to happen after acne, because usually with acne, when it disappears, it leaves something out, and it can leave 3 things out: hyperpigment. I can just hyperpigmentation, post-inflammatory hyperpigmentation, post-inflammatory erythema, and acne scarring. This is the first 2 I just mentioned. So when you pop some acne pimples, which is not recommended, hyperpigmentation of skin can happen due to inflammation, and it triggers skin cells to overproduce melanin, and that is why it's hyperpigmented, because it's darker marks on the surface of your skin. It's often confused with post-inflammatory erythema, but that's because of just damaged blood vessels, so that's why it's red instead of darker areas of your face. But they both can still be caused by acne, and if you pop them, actually. An important note for this, these 2 are temporary. They will fade over time. You know what isn't though? Acne scarring. That's why you shouldn't pick your pimples at all, because you still have a possibility of acne scarring. You have a possibility of PIH and PIE, but you can also have this, which is permanent, because you don't want to have that. By the way, I think PIH and PIE, it's more likely for people of paler skin to have PIE, and for people with darker skin to have PIH. Um, I think it's because of you can look at it in the Fitzpatrick scale, which is just a scale where 1 is the palest skin, and 5 is the darkest skin you've seen ever. PAH, PAH is more common for darker skin tones, and PAE is more common in lighter. It's just something to look at. So we're going to get acne scarring. So any type of acne spots can unfortunately lead to scarring, but it's more common when the 2 serious pimple types, so the cysts and nodules, they burst and they damage nearby skin cells. So this results in disruption to the skin's production of collagen. Um, and these are the type of acne scars that you can get. You can see how collagen affects them as well, because if you have too little collagen produced, it will result in atrophic scars, meaning scars that go below the skin. So these are atrophic. The 3 main atrophic scars are aspic, rolling, and boxcar scars. Those are 3 main. And too much collagen produced can result in hypertrophic, which is this one, the single one, raised papules. Squeeze, and also, of course, scarring can also occur if you pick or squeeze your spots, so don't. And always remember, this is permanent. Don't ever pick or squeeze your spots, because this is permanent. Now we're going to do treatment for all three of these. And just to let you know, they're pretty common. They're pretty shared. I mean, treatments for these three. So of course, with PIH, the hyperpigmentation, you want to look at targeting the melanin production and trying to control it. And some people might want to have treatment for PIH and PIE, even though they would fade over time, because that time can be long. A time span can be long, months or years to do so. And I think the darker the skin color, the longer it takes for PIH to fade away, unfortunately. So here are 6 ways of treating PIH. So topical agents, so hydroquinone, ooh, azelaic acid again. That was used for acne as well. So a lot of medicine here, it actually overlaps with each other. It's pretty good. Allergic acid as well. And what it does is it inhibits melanin synthesis. Well, that might make you whiter than you are, though. Be careful. Vitamin C serums, it helps brighten the skin and prevents further hyperpigmentation. Be careful of that though as well, because that was what made me have acne in the first place. Chemical peels, which contain glycolic or salicylic acid, those are pretty good. Salicylic. They exfoliate pigmented layers and reveals fresher skin beneath. Sunscreen prevents hyperpigmentation because UV light can actually make your skin darker because it makes your skin produce melanin. And it's pretty stupid just to say don't go outside because everyone does, hopefully. So the best case scenario is just wear sunscreen, and because you don't want those hyperpigmented scars to appear more, to stand out more in your skin, on your skin. And these are the last two, last resorts. These last two. For more persistent cases, you can do laser treatments. Those are also shared with PIE and acne scarring, which just breaks down excess melanin in the skin, and regular use of retinoids. It just helps fade dark spots over time. Now we're going to PIE treatments, and they're pretty similar. Again, topical, so on the skin again, azelaic and niacinamide. Again, just soothes inflammation to reduce redness. Azelaic acid is pretty good because it does a lot of functions. Because you already seen it treats acne, it treats PIH, now it treats PIE. Pretty good, honestly. Laser therapy again. This is a named version. Intense pulse light uses broad spectrum light to diminish redness. That'd be great to research. And for some cases, microneedling, that can be great for stimulating collagen production and skin regeneration. That's actually pretty good for acne scarring as well, especially for those atrophic scars, the ones that are deep in, the ones that are into the skin, not out of, not the raised ones. Yeah, and now we're going to do the treatments for acne scarring. This is topical because these are just stuff you can just get over the counter, but there's also surgery. By that point, the NHS regards it as um, cosmetic, so NHS doesn't actually just give you that. You have to pay for that. It's probably expensive, but if your acne scarring is pretty bad, might as well do it. Again, retinoids, pretty good for acne scarring. Salicylic acid, it was said in PAH as well, I think. That's pretty good. Anti-inflammatory properties. Reduces acne by exfoliating the skin and breaks down fats within cells, which can reduce the appearance of acne scars. Good. And there's also lactic acid, and it removes dead skin cells. There's statistics in it as well. 75% clearance of lesions after 3 months. And now we're going to the cosmetic surgery. Chemical peels again, pretty good. It's for deep acne scars, that's good. Strong acid. Lasers again. There's another term for that, dermabrasion. What it does is just removes the top layers again. Top layers of damaged skin to reduce the appearance of acne scars and lets the healthy skin thrive and um, and just replace it. Microneedling, as I said it before, punctures the numb surface of acne scars, and it should make your skin naturally heal, and it encourages production of collagen. So that can fill the areas where there is an underproduction of collagen due to acne scarring. But of course, the side effects are it can cause scarring in the first place as well, and post-inflammatory hyperpigmentation. That's bad. And this is for now we're looking at these two specific types of acne scarring, atrophic and hypertrophic. Atrophic is the depressed ones, the ones in your skin, usually dermal fillers. So you can probably guess what that is. It fills your skin. It fills your skin with stuff. It does make it smoother. It lifts the skin upwards, makes the scar less noticeable. And usually you do hyaluronic acid to improve the scar severity in 67% of people. Pretty good. And for hypertrophic, the ones raised, keep cryotherapy is used. And that's when you apply liquid nitrogen to the scar to freeze it, and it damages the abnormal skin cells to kill them off so they can be replaced with new, healthier skin cells. That is all the treatments for PIH, PIE, and acne scarring, all three. And you can see that for acne scarring, there's no actual way to remove it. It can just relieve the symptoms, make them less noticeable. That's the only best thing you can do. You have to carry them in life. Best case, so best thing to know from this, please just don't pop your scar pimples. Here are the references. Hopefully they will come up now. Yeah. And thank you for listening. Obviously I should have done this when I was less sick. It would be way better.